Welcome to Caregiver Chats. Today, I'm talking about Veterans Assistance, VA benefits. So stay tuned and we'll get into it. Hi, Dr. Lakelyn here. I'm a gerontologist and caregiving advocate for Home Instead, an honor company. I'm so glad you're taking the time to listen. Be sure to subscribe to Caregiver Chats on Apple, Spotify, or your favorite podcasting app. I also love your questions. You can email me at caregiverchats@homeinsteadinc.com. That's caregiverchats@homeinsteadinc.com. I actually get a lot of questions from caregivers on resources to help pay for care. And at Home Instead, we have created a free funding solutions guide that I've linked to in the show notes to help families understand various payment options. I also cover caregiving and finances in episode 23 of the Caregiver Chats podcast, so you'll want to be sure to go back and listen. Today, I want to dive deeper into one of those payment options, Veterans Assistance, or the VA. Many caregivers may not realize that there's support available through the Department of Veterans Affairs that can help ease the burden of caregiving. These benefits are not just helpful, they are well earned by the men and women who have dedicated themselves to defending our freedoms. Unfortunately, navigating the system and accessing the resources can sometimes be overwhelming. And that's why I'm really looking forward to today's conversation with an expert on VA benefits, Greg Bean. Greg is a veteran himself and a seasoned healthcare expert. He began his journey as a hospital corpsman in the U.S. Navy and had an extensive career in the home care industry. Greg is a proactive advocate for VA benefits and is now serving as the VP of Business Development at Paradigm. I'm excited to learn more from Greg in our conversation today. Welcome, Greg. Thank you so much for joining me.
Oh, thanks for having me on.
The pleasure is all mine. We had a chance to meet kind of leading up to this episode, and you shared a really interesting statistic that I thought would be great to kind of kick off our conversation. And I don't remember the exact statistics, so I might have you kind of remind me, but it was something to the effect of there are so many people that qualify for VA benefits, but there is not equal number of people that are receiving the benefit. So please tell us more about that. Yeah. Why are people not tapping into this benefit that could be so useful for them?
Yeah, so let me just kind of throw kind of a grandiose overview of where the VA's at and where those numbers might be. There's 16 plus million veterans in the United States today, with over 10 million of those veterans being over the age of 65. And another 4.5 and some change veterans who have service-connected disabilities, which are actually veterans who have a service-connected disability in the system. With that being said, only about 173,000 veterans in the entire United States are getting home care benefits. Now,
Wow.
This is not home health necessarily with skilled nursing and PT and so on. This is someone who's receiving hourly assistance to assist them with their activities of daily living.
Wow. So it sounds like there are millions of people that might be eligible, but only a couple 100,000 that are actually using the benefit.
Probably less than 2% of the actual people who could be or eligible to receive benefits are actually receiving them, an estimated 2% or less.
Wow. Well, I'm extra glad that we're talking today then, because I think our goal collectively is to really help families understand, okay, what are VA benefits? How do we go about looking into them? So I'm really excited to dive into all of that with you, Greg. And I think it might be helpful to start out with more of an overview of the various programs that are available, the types of benefits through the VA. I know there's things like home helper assistance, respite, family caregiver and veterans directed care. There's also aid and attendance. So I think people hear some of these terms that are talked about in relation to VA, but can you help us just better understand all of these types of programs and what benefit they would have to the person receiving the service and to the family caregiver?
Right. So I think there's 4 programs that kind of jump out that are kind of the mainstays of today's program that can assist a veteran getting services. A couple of them are very specific back to the family themselves, and others are specific maybe to the veteran from a different level. So I think I'll just jump in from all four, and then as we go through, if we want to do questions and answers around each of those four, but I'll just
Yeah.
run through the list. So
Sounds great.
the first program that we would think about would be the Homemaker Home Health Aid and Respite Program through the Community Care Network. So now what does that mean? So that means a veteran who has a need for assistance with activities of daily living. If they have a service-connected disability, they're automatically eligible for these benefits. If they don't, they can actually enroll in these benefits. And after we go through the programs, we can talk about it, how to enroll in some of the specifics about enrollment. But they can actually enroll in the benefit, enroll in VA Health, and then have an authorization for care through a third party providing these services to them on an hourly basis. So that's the program that's pushed out there, that they're getting an authorization from case management at the local VA hospital that's going to a third party to be a provider of care, an agency per se.
And when you say sorry to interrupt you, Greg, but when you say third party provider of care, just in case people are like, what does that mean? It would be a company like a Home Instead. Is that right?
That is correct.
A home care agency.
That's correct.
Okay. Just wanted to help.
Yes.
Yeah. Help with that terminology. Absolutely. Okay. I'll let you continue on.
Yeah. So the next program would be what they call aid and attendance pension. And the aid and attendance pension is a pension paid to a wartime veteran, a veteran's spouse, and or surviving spouse to assist them in paying for personal care. So if the veteran qualifies for the aid and attendance pension and they're receiving care through the pension, then the spouse can also receive a stipend and assistance for care.
Wow.
If the spouse was married to the veteran at the time of their passing, and the veteran was a qualified veteran, then the spouse can receive assistance. And there's some stipulations, and we'll kind of go through each of these programs after the fact to talk about enrollment into each and what it looks like and the financial constraints and so on that go on it. But this is a pension. It's called aid and attendance pension. It's actually a pension paid to a wartime veteran to assist with paying for personal care. At which point in time they can go out to an agency like a Home Instead, and they receive that stipend. It's paid to them, and then they can hire a company like Home Instead to provide them hourly assistance with that stipend.
Okay. That's great to know. Well, and I think it's so helpful to understand that not only for the wartime veteran, but also their spouse could potentially qualify, and even, after the passing of the veteran. So I think another reason why it's so great that we're talking about this is to help educate family caregivers that even if, you're maybe aging parent, maybe the mother is still living and the father passed, but he was a wartime veteran, she could potentially qualify. And I know we're going to get into more of those qualifications in just a bit, but yeah,
details,
it's good to know.
The third program that we would talk about is actually called a family caregiver program, or person. And again, there's some acronyms associated with it, but PCAFC is what it's actually the acronym for it if you were to go in and to look the program up within the VA's website. But it's the family caregiver program. And what does that do and what does that mean? So a veteran who has a 70% service-connected disability or greater can actually, their family member can apply for the benefit to be a paid caregiver for the VA, at which point in time they're actually hired by the VA. They receive a monthly stipend from the VA, and they receive things like health benefits. They're actually an employee of the VA at that point in time, and they get a monthly fee to be the primary caregiver for the veteran. Now, alongside of that, one of the benefits alongside of that is they actually have the ability as well to receive respite from an agency, third party, like Home Instead or another agency of that type, to actually receive respite time on top of their stipend. So they're being paid, they're an employee of the VA, they're providing care full-time to their loved one, and they can still get respite time to give them a break from that, paid for through the VA for that care.
Wow. Well, that program is great for a lot of reasons. I get asked a lot by family caregivers, how could I get paid as a family caregiver to care for my loved ones? So it's so great that that program exists out there. But then we also know how important respite is, time away, so that those caregivers can continue on, because we know caregiving, no matter who you're caring for, can be very challenging at times, and we want to, of course, avoid burnout for those individuals. So having that respite can be just so beneficial.
Right. And then the fourth program, which we will, again, we'll dive a little bit deeper into on the back end of things, is what they call veteran directed care, or VDC. With the veteran directed care, it's a consumer driven model. What does that mean? It means that the veteran actually has the ability to hire anybody out in the community. They're working with a case management team. They've qualified for benefits just like they would under the Homemaker Home Health Aid, whether they're service connected and or have applied for benefits and get their benefits as a veteran. They're receiving that care from the VA, the authorization. They can actually apply for, be enrolled in the veteran directed care, at which point in time they can choose anybody they want on the planet to be their provider of care. And then that person gets paid through a broker or a third party to be the caregiver. And the veteran chooses them when they come and go. They get an hourly stipend back from the VA to how many hours per week that person gets and the pay that they can give them and so on, but allows them to manage and provide that care on the back end. We'll talk about some of the positives to that when we get into that, the requirements here in a minute, and then the potential negatives to that for some of the liability assumption and so on back for. But the whole idea of this is that in many cases, this actually fits very well into the family and into the veteran's need. And it's another option or another opportunity for them to manage their care, which I think is vitally important, that we explore all of the options and all of the opportunities allowed for our veterans.
Absolutely. Well, and we know every caregiving scenario and dynamic is unique. And so having that flexibility to really meet the family where they're at, the veteran where they're at, and provide for the needs can be so helpful. And also we know, there's not always a wealth of providers in some of the more smaller, more rural communities. So having that flexibility on who you can hire and how the care is delivered, I'm sure can be so helpful in a lot of situations. So it sounds like you've covered all four so far, Greg, kind of at the very high level. Yes. I know we're going to dive in and provide kind of more of the logistics and whatnot, but I always love a good story. So I'm wondering if you have any just examples, any stories of families who kind of uncovered this benefit and really found it to be helpful and life-changing. And then we can kind of get into more of the specifics if you don't mind sharing.
Oh, absolutely. I mean, I think, I can use my own family as an example. So, my father, who was a Korean wartime veteran who had hearing loss, for instance, and from his time in the military. Later in his life, when he needed hospice assistance, because of his service-connected disability, he didn't even realize that he actually had the ability to go and get care. And because he was a service-connected disabled veteran, he was automatically enrolled in the VA's health system. So they were able to actually have him seen by the local VA clinic and hospital, and they were able to authorize care and services back to him through end of life. So they were able to get a caregiver, whereas he wouldn't have realized he was able to get it. So kind of what ties into that was initially, and I'll use, like with myself, I received my disability and got out of the military in 1985. At that point in time, the only reason I could be seen at the VA or a VA clinic or hospital was specific to my disability, which might the fact that I'd broken my legs and had surgical repairs to my legs. So that was the only reason I could go to the VA. Well, this was in 1985. Well, in 2011, Congress passed a law, and if you have a service-connected disability, you're eligible for all VA health benefits. So now if I had cardiac problems or needed medication assistance or anything else that might go on in my life because I'm a service-connected veteran, I'm eligible for those benefits. But what didn't happen in 2011 is nobody called me on the phone from the Veterans Administration and said, Greg, your benefits all changed and you can get this. But neither did the other 16 million veterans out there in the United States, or the 5 million that have service connected disabilities, or the ones that could actually understand how to enroll in benefits or get benefits back through the VA. No one's called them on the phone and said, let us help you or walk you through these platforms and
Yeah.
pieces and parts to actually help you to understand the benefit. So I'm hoping at the completion of this, anybody that's listening or has a piece of it will say, oh my gosh, here's how I can go find out how to get benefits for my loved one.
Yes, absolutely. That's really helpful context to have, Greg, that, that legislation changed in 2011, and that, it sounds like benefits really opened up to a lot more people, or at least the types of benefits that they're eligible for. So, so glad again that we're diving deeper into this topic, and feel free to keep the stories coming along the way as we dive into more of these kind of more specifics. But I know that sometimes I hear family caregivers talk about how it can take a while to receive benefit or to enroll, or they're kind of confused by qualifications and whatnot. So, could you give us some kind of just insights or keys to success when kind of getting ready to go down this path of exploring VA benefits?
Yeah, so let's just jump into each of the programs and talk
Yeah.
about enrollment into each one, because each
Sounds
one has
good.
a little bit of different process associated with them and understanding how to go there and what to do. So the first one, when we talked about homemaker home health aid respite, or the community care network, or any of those pieces or parts that you want to receive care, this is a benefit paid to a veteran or a service connected veteran who has needs with activities of daily living. So dressing,
Okay.
clothing, mental or emotional issues. So they can have some, if they have Alzheimer's or Parkinson's disease, or things which are actually having mental health issues, can actually be pieces and parts that can fall into this. All these become factors associated with increased needs for activities of daily living.
Mm.
So a person wants to enroll to get assistance for the VA. If they have a service connected disability, they're already enrolled in the VA's health system. So that means it doesn't matter why they went to the VA. When they got out of the military, or they've been out of the military, they went back and said they had hearing loss, or they had ankle problems or knee problems or PTSD, or whatever their reasoning was that they went to the VA to request services and care, they were given a service connected disability. And so if they have that connection, all they have to do is make an appointment with their local VA clinic or hospital and say, I want a doctor's appointment with a primary care physician, and I want assistance with activities of daily living.
Mm.
That physician will then send a referral up to case management at the hospital. They will create an authorization around the care needs of the client, the veteran, and then send that referral back out to their agency of choice. Someone like a Home Instead, or one of those other when I talk about third party providers, veterans
Yeah.
have 100% choice, and they can choose whichever agency they wish to provide that care. So that's how we would push those back to them. Now, a lot of people think that a person has to actually have a service connected disability to apply for this benefit, but they do not. If they joined the military prior to September 7th of 1980, and they make less than the income threshold requirement. Now, what is that? I will tell you that in many places in the United States, it's $56,700 a year in annualized income. If you
Mm.
go onto the va.gov website, on the front page of that, or the first page, you're going to say, qualifying for health benefits. And it says income requirement. And it's going to ask you things like, are you married? Do you have children? Things along that line. And you're going to put in your zip code in that page. And it's actually going to give you a number of what your income threshold is.
Mm.
Assets are not important here. You were discharged other than dishonorably. You were in the military prior to September 7th of 1980. And your income meets the threshold. Like I say, I just spoke to someone in Denver, Colorado, for instance. Their threshold was 72,000 and some change per year. As long
Mm.
as their income, annualized income, is below that number, they qualify for benefits.
Wow.
So, and assets do not mean anything with this program. So if you join the military after September 7th of 1980, the only difference is you have to have been discharged other than dishonorably. You have to meet the income threshold, and you have to have served 24 consecutive months of active duty in the military. So long as you serve 24 consecutive months, you are honorably or generally discharged, and you meet the income threshold, you can apply for benefits. Now, the first thing we say then is, how do I apply for benefit?
I'm sure that's what's on people's minds.
So what I would do, I will actually give a phone number here online. Okay, I'm gonna read it off here, but it's 404-828-5257. If you call that number, you can actually enroll in VA health benefits over the phone.
Oh, wow.
So
That's
instead
great.
of having to go and search for documents and find documents and create documents, the only catch to this when a person goes to enroll is the enrollment specialist on the other end of this call is going to have to send them an email upon the completion of the call. Here's where the challenge comes in for many of us, understanding that we have to have access to an email.
Yes.
And then we're going to have to sign a DocuSign document that's basically an attestation that everything you just told them on that 1.5 to 2 hour phone call is accurate and true.
Okay.
The great part about this is when they finish that call, the person at the other end of that, the enrollment specialist, can actually set them up with the VA hospital/clinic for their first appointment to get enrolled into VA health benefits. So
that's fantastic.
All in 1.5 to 2 hour phone call, they can complete their enrollment, they can sign up for benefits, and they can get scheduled by the VA physician to be seen for their first time. They do not have to stop their primary care doc with their Medicare or their normal insurance. They don't have to change insurance plans. They don't have to stop the services no matter where they're getting. If they've had their same physician for 50 years and they love them, they can keep them. But they are going to have to see a VA specialist physician to enroll in the program, and that can all be done over the phone.
Wow. Well, and we'll make sure, Greg, to put that phone number in the show notes so that people can easily access the phone number. So it sounds like for this program, setting aside at least 2 hours to call the number, to provide the information, making sure that there's an email address that's available and a device where you can do the DocuSign, and then you get that appointment set up. And it sounds a lot easier than a lot of the other programs out there to support individuals and their caregivers.
Right. Well, if you go online to the VA's website, basically there's an enrollment process that they can do online as well. But they're going to have to chase down a copy of their DD-214, which is their military documentation of when they served. They're going to have to chase down an income statement. They're going to have to be able to upload those onto the VA's website and do an upload of their documents and create uploads. So if the person is incredibly computer savvy and they want to go in and do that, they want to do it electronically and not speak to a person in this, the VA says they'll respond in 10 to 14 business days. And then after they've done their response, then you're going to have to make a doctor's appointment at the VA yourself to be seen. By far, the simplest procedure to do here is to spend 1.5 to 2 hours on the phone and complete your enrollment and move forward with the process.
I like that advice. Okay, I would love to hear some keys to success for some of these other programs. So that was the home helper, respite, and
Homemaker, home health aid and respite program.
Thank you for reminding me.
The next program would be your aid and attendance pension. So yes. Aid and attendance pension is a much stricter program around finance as well as how much money you have in assets. All of these things come into play. You have to have served specifically during a wartime period, and that's on the VA's website, but there's specific enrollment dates for when you were in Vietnam, when you were in Korea, when you were and they had to have been in country during wartime in one of those direct periods. The only kicker to this is from the 1990 on, when they started into the Gulf War and so on, there is no date set by the military for what that date is. So if someone was later to that, they could still apply for benefits as a wartime veteran and get them.
Okay.
Here's the keys to that program. They have the dates met for time. Their total assets have to be under $155,526, not including a house, car, and up to 2 acres of land, unless those are sold and then they become an asset.
Okay.
Okay. And their income has to be paid down below the benefit of the pension. So they actually have to start care with a provider, be paying for assistance in care, and then they're going to
Okay.
receive this paid stipend back to them from the VA. But they can file a intent to file. It's a one-page form. They can fax it to the VA. They can print that form, fax it to the VA, and it actually locks their benefit time in from when they submit that form. So they'll be back paid to the date of enrollment.
Okay.
So if they meet that threshold and they meet the finance and they meet the dates of service, then they get a monthly stipend paid to them at the first of each month. It's electronically put into their bank account. And then they use that money to hire an agency, such as a homestead, to actually provide the care to them, and they pay out of that stipend.
Okay.
The VA does audit them. And what they do for an audit is they check to make sure that they're using that money to pay for care and assistance, and they don't go out and buy a new car, a new house, or wherever the stipend is. It's actually for care and assistance. So the
Okay.
audit is actually quite simple. It's just a matter of showing where you paid your bill and any care notes associated with that. And those are all supplied back from the agency that's providing care and assistance. But this benefit's also allowable to the surviving spouse.
Okay.
Or
That's the difference
that's the
that
big
I'm
difference.
hearing.
If the only surviving spouse or spousal benefit paid through the VA is through the homemaker home health aid benefit as far as for care. So that's aid and attendance pension.
Okay.
And they're pretty drastic. One is actually a pension paid. It's not associated with a amount of disability or any of the above. You have to have activities of daily living needs. And that's documented by your physician. There's forms you fill out, and it's a bit of a tedious process. And sometimes it can take 4 to 6 weeks to actually get your reimbursements and your payments started, but it goes back to the date in which you enroll.
Okay. So with that one, it sounds like getting started sooner rather than later is going to be to your benefit
Right.
if it takes a little bit longer.
Right. Now, just so you know, every single county in the United States has a Veteran Service Office, or a VSO. If you look up in your county, whatever county you're in, it doesn't matter where you are in the United States of America, there's a Veteran Service Office. It's usually at the county offices. So many times it's at the courthouse or county buildings or whatever it might be. The Veteran Service Officer in every single county has the ability to and can assist veterans and family members in filling out all of this paperwork and enrollment. And it's free.
Wow. That is a really great tip. I'm so glad you mentioned that.
So we were just talking about it being tedious and having to understand the finance and the dates of service and all these things. Every single county has a Veteran Service Office. So if you're in a remote county, I'm here in Pennsylvania, we have, Lycoming County and Bucks County, and I could go all through the counties. Every one of them has a Veteran Service Office in the county that can assist them with this platform.
That's really helpful to note, and for family caregivers to know about, because they might be thinking, well, where can I go for support? So looking up the VSO would be so helpful in kind of kicking off this journey of applying for that aid and attendance.
Correct. And they also can assist them. The Veteran Service Office, as we talk about family assistance and care and needs of our veterans, they have resources and ability to help them with things like access ramps and handrails. And we have a client recently in Indiana as a great example, who the veteran was receiving benefits and was a terrible hoarder and needed assistance. And he wanted the place cleaned out as much as what the other people went. And they went to the Veteran Service Officer, who reached out for community organizations, and they actually were able to go in and help this veteran clear out his house. And the agency that was helping him. And so this Veteran Service Office helped them with all of those things. There's a young man here in Pennsylvania. I say a young man. He's not really young, but he's about younger than I am. He's in his 40s, but he's the Veteran Service Office for Bucks County, Pennsylvania. If you were to ask him what is his purpose in life from the veteran service officer, it's to eliminate veteran homelessness. And he's been
Mm,
responsible for building over 200 mini houses in Pennsylvania for homeless
wow.
veterans. So with help from donations and community organizations and so on. So your veteran service office has a massive uh, accessible group across the country to help veterans and veterans families with the needs that they have going on in the community.
That's so wonderful to know. I'm so glad that you shared that tidbit of information. Greg, it's so great to know about the VSO, the Veteran Service Offices. And as I'm thinking about all of these programs, can they help a veteran get started to look into any of these programs, or is it just the specific one that you mentioned?
Actually, they have the ability to assist veterans in enrolling in all of their veteran benefit programs and understanding what the programs are and helping them to dive into each and every part of it. So they are an amazing community resource back for veterans around all benefits.
That's fantastic. Okay, so that sounds like the kind of the keys to success for the aid and attendance program,
Pension, right.
aid and pension.
That's correct.
Yes,
And then
yes, aid and
the next
pension.
is the family caregiver program. It's or the
Okay,
PCAFC program for comprehensive family supports. They can actually go right onto va.gov. Okay, the family member, they can do their application online, and it's the primary caregiver of the veteran who has activities of daily living needs, whether they're
hmm
physical, emotional needs that are going on with them, disease processes. They fill out that application. The veteran has to have a documented 70% service connected disability or greater. And then that
okay,
family member receives a monthly stipend from the VA to be the primary caregiver of the veteran. And that's the only place I know where they do the application is just right through va.gov family caregiver
okay.
program application, and it's done online. From what I understand, that can take 4 to 6 weeks for the whole application process. But the VA offers supports with training and education, and they have a family support group associated with it. It also ties them back into assistance with respite through third party providers or companies such as Home Instead and agencies like that that can actually provide them with the respite care on the back end of it. But the key to this is now that family caregiver, that primary caregiver of the veteran, has the ability to receive a monthly stipend, become a VA employee,
Mm,
including insurance for them, and so on. So it really ties them
wow.
back into care and support and finances back to the family caregiver that otherwise they wouldn't receive. And many times, they're trying to work a second job or a third job, or they're working
Yeah.
around the veteran, and they're really trying to make ends meet or make do. This gives them a stipend and the ability to make money while they're actually providing the care and giving them the support to these veterans in need. And it really does genuinely help the family and the family core group.
Yeah, absolutely. Those would be such a game changer for so many family caregivers. So we'll make sure to include links and again, that phone number in the show notes so that people can go to the right places and make sure that they're, you know, going down the right path for applying for these various programs. Were there any other tips that we haven't covered yet, Greg? Any other
I think
things to consider?
I think other than just veteran directed care, just kind of jumping into what that means and what it looks like for the fourth of these programs that I think is
Yeah.
vitally important. It's for non-skilled caregiver providing, so it's directly for the home health aid type service. It's it's a program in which the VA expects you to have a support group in place prior to moving over to this program.
Mm,
And why would that be? I mean, some of the challenges that might come about with not utilizing an agency or not using, you have to qualify for this program just like you would under the Homemaker Home Health Aid and Respite program. It's the exact same qualifying piece. So you have to have either been service connected and or get VA benefits and apply and have them see that you need activities of daily living. But with this program, it gives you autonomy and the ability to hire who and what you want and have them come when and if you please. But if the veteran doesn't have a support group in place or family members in place or other things in place, what happens if the person they hire changes their employment status and leaves? What happens if
Mm,
the caregiver doesn't show up for work on any given day? What happens with the liabilities associated with having a caregiver in your home if they're not connected through an agency? So there are some pieces and parts of that that I think genuinely a veteran needs to look at when they go out to hire somebody independently,
mhm.
especially when you know that they can actually just utilize the same benefit through the community care network, through an agency, and all of these things can be met by a caregiver who is licensed, bonded, and so on. And then there's a backup to them if they receive the care. But again, it gives them autonomy where they're not having to utilize an agency and they have some independence with who they're utilizing, but they have to have the same needs that they would if they were using an agency to provide that care.
That is, I think, helpful to understand, Greg. And, I get asked a lot about hiring an agency versus hiring privately, and there can be pros and cons to both. And so I think that you pointed out some really important things to consider. When you hire, someone directly or privately, you do become the employer and take on those responsibilities. And if you hire an agency, then that agency is their employer and kind of handles any employee related issues that could potentially come up. So again, I think that these 4 programs that we've covered help to give caregivers an insight into what support might be available, because I know so many people feel like uh, there's not a lot of support out there, but it might be that your person, the person you're caring for, your loved one, could potentially qualify for any of these benefits. And Greg, specifically, I know our podcast, we focus more on caring for an aging loved one. So are there common scenarios that you see in the older population that would qualify them for these benefits? I know you mentioned Alzheimer's disease and other dementias and Parkinson's. Are those some of the more kind of common ones that you're seeing people get qualifying for these benefits in relation to?
Well, but we could go through medical and health issues. We could have people that have had acute brain injuries or strokes. We could have people
Mm,
that have falls and back injuries. They could have traumatic brain injuries. I could go on and on with some of like the rehab type things that are going on in the world. Even that person that's a brittle diabetic or has what we would call a failure to thrive, or they're just not understanding that they're eating correctly or
mm,
needing to eat more, which causes them to have falls and weakness and issues going on in their lives. Um, you know, our veteran population is an incredibly proud population.
yeah.
And many, many, many times they just don't want to tell people they need help. And
Hmm.
what I would say to every family member and to every veteran out there on the planet is, what do you do on your worst day? Because so many of us say, I don't need help with that. And it's because my wife helps me, or my daughter, or my son, or
Mm,
my husband help me. I have help, and so I don't need help from the outside. But what if they're not there on any given day? And what if they need that relief? And what if we need these
yeah.
opportunities? Taking advantage of veterans programs is so vitally important, and having an opportunity to provide that care. And it doesn't cost you out of pocket.
Yeah.
So, what's a little bit of a relief back to the hero that's taking care of us there all day, and not just ourselves, but the heroes that take care of us day in and day out. Giving them a break is also a big piece of this. The other thing that I hear veterans and people talk about, well, if I take this benefit, it's being taken away from somebody else who might deserve it more or might need it more.
Mm,
And I would tell you, every single time someone enrolls in the program, the Veterans Administration is a massive um, managed care organization per se. So money gets allocated to you when you move into that system, not from another veteran or from another program or whatever. It's allocated back to each veteran through the system that's allocated into the system. So you're not taking anything away from a client. You're not taking anything away from somebody who quote unquote might think might be more deserving. If you have these needs and you're a veteran, you're deserving.
mm,
And if you're a family member of this veteran and you're taking care of them, you're a hero as well, and you're deserving.
yeah. That's so well said, Greg. Absolutely. I think that I think humans in general, Americans in general, we're very proud people. We're very independent. And so asking for help can be hard. And so I love the encouragement that you just provided, because I don't see asking for help as a sign of weakness. I see it as a sign of strength. You're wanting to remain maybe in your home longer and stay as independent as long as possible. And so sometimes you just need a little extra help and support to do that, or extra help and support for your caregiver or care partner to help them get a little bit of a break so that they can continue to care well for you. So, thank you, Greg, for being here and for sharing all of that information. And with you being a veteran yourself, thank you also for your service.
I would just close with one thing. And,
Yeah,
we talk about independence, but how much longer can I stay home? And how much longer can I stay independent? And how much longer can I be in my home and not have to move someplace else or change the way I live or where I live if I just have a little bit of care? Whether it's a light housekeeping, a little personal care, a little bit of help around my home. What if I have that personal assistance and someone just stopping in and making sure that I'm making it day by day and doing it really, really well? How much better is my quality of life? I think that those are drastically enhanced by having a caregiver to assist you, even if it's intermittently throughout your week.
I would agree. I think that's a great last tip and thought to wrap us up with. And again, Greg, thank you so much. We'll make sure to share your information, Paradigm's information, in the show notes, along with all of the VA websites and phone number that you mentioned. I just want to say thank you again so much for being here and taking the time to explain those 4 different programs through the VA and tips on how caregivers can hopefully very successfully and easily enroll in them.
Right. Well, you have an amazing day, and thank you for having me on.
I want to thank Greg again for joining me today. I hope that our conversation helps you better understand the programs that are available for veterans and their caregivers. I also hope that the tips Greg shared helps you take the next steps in finding out if your loved one qualifies for VA benefits. You can check out va.gov, their website. You can give them a call or find a Veterans Service Office, a VSO, near you. If you have additional thoughts or stories to share on this topic, I invite you to email me at caregiverchats@homeinsteadinc.com. That's caregiverchats@homeinsteadinc.com. I also invite you to follow us on Facebook at Home Instead Inc. That's Home Instead INC, for previews of upcoming episodes, caregiving tips, and more. You can find all of the links in today's show notes. Thank you for listening, and please remember to take good care of yourself while you care for others. Caregiver Chats is brought to you by Home Instead. If you're looking for in-home care to support you on your caregiving journey, please visit homeinstead.com to learn more.